first slide, and then I'll hand over to Kristi, who's a much more enjoyable man to listen to, I can guarantee you that. So, we were founded in 2004 by a gentleman called Dr. Brent Dorval, and his not insignificant claim to fame was he invented the first rapid HIV diagnostic. So that infectious disease approach percolates through everything we do. So again, a good example of that is we run 15 standards and controls per patient to make sure the testing is highly accurate as well as highly reproducible, which are both things that have had a knock-on effect in the food sensitivity area, so we want to make sure that was important and taken care of. We're based in Boston, as you can probably tell from my strong Bostonian accent. So again, we've got a 20,000 square foot facility there. We have ISO and FDA registered manufacturing facilities. We also have 2 clear high complexity labs. And everything we do is based around the patent that we had granted in 2012. So again, we're the only patented food sensitivity test on the market, and we control all aspects of the process. So I can even tell you who caught the mackerel that sits on our FIT 176 panel. So all the foods are organic. We own the C3D cell line. So again, to make sure we have the accuracy that we have is because we control all aspects of the value chain, including the C3D cell line that we own, that we purchased from a gentleman called Bo Nielsen, who's one of the godfathers of complement medicine. And last but not least, we have testing going on all around the world. So we have labs now in Mexico, Brazil, Shanghai, London, and our main one in Boston, as I mentioned. The one in Boston, just to give you a quick idea, in China, to give you an idea about, we'll talk about some of the data that's generated there in terms of talking how robust the test is. Some of you might have seen this, but our booth is right next to where you registered this morning. Apologies if any of you had a long wait whilst you were registering, but if you were looking, we were just off to the right-hand side. Very, hopefully interesting for you all. We're doing discounted kits there, so you can have the ability to get tested whilst you're here today. On the basis, as I say, we've been doing this for a number of years now, and I know there's a kit in pretty much every state that sits on a shelf in one of your offices that you picked up at an event and you never used. So we've tried to fast forward the process a bit by offering the testing here in the building, so you can get tested for a discount of $200 as opposed to the normal $385, and fill out a new account form as well. So that's the kind of housekeeping dealt with. Without further ado, let me pass you over to Kristi, and hopefully you'll enjoy lunch, and I'm sure you'll enjoy the talk.
Well, it's an absolute honor to be here, and for those of you who have been in any sessions with me, I tend to talk fast, so I've got about a half an hour with all of you today, and I'm going to focus on the clinical aspects of using this tool. So I have been in my private practice, as James mentioned, since '97. As a naturopath, it was always food first, right? That's where we started. In the naturopathic training and the functional medicine philosophy, it is always starting in the gut. It's starting with the food first approach. So I have basically used everybody's tests over the course of the last 25 years of clinical practice. And I did get the opportunity to meet James and the team in Beijing. I was there teaching functional medicine tour while I was in that area, and I had the opportunity of meeting James and starting to talk about what was unique and very different about the way their lab was presenting data and looking at some of these clinical correlations. I came back, started using their test, using their program in my own practice, and I have to say it has absolutely been a game changer for many reasons, and I'll share some of my case studies with you today. I was joking with James this morning, but now I think I probably should do this to get the numbers. I think my practice, my office, has run, I'm going to guesstimate, about 500 tests from KBMO so far. So I'm a single practice, primary care, and do a lot of work with patients in food and nutrition. And say the 2 areas that are my specialty and my deep passion is nutrition and nutrigenomics. Say really looking at that personalized approach and giving patients an opportunity to transform their lifestyle, eat right, move right, live right in a way that's going to be ideal for them. And I would say there's 2 tests now that I would say after all these 25 years of practice, I have pretty much put into my lineup for almost every new patient that walks through my door. I can pretty comfortably say 90% of every new patient that I'm going to work with is going to get a KBMO, and they're going to get a 3x4 genetics test. And those are the 2 launch pads that I really use for starting to dive in, customize the diet, look for genetic susceptibilities, and get a good sense and understanding of where inflammatory complications may lie or body comp challenges may be. And I most certainly want to be looking at my various different inflammatory neurologic complications. So just stepping back to talk about food, as many of you obviously already know, there's different types of food assessment that is integrated, and what I am so pleased to see in the KBMO report is not only are we picking up those patterns of IgG4 sensitivities, which we know that testing has been around for quite some time. We've been running them in our private practices often for 20 years, some of us. But what's new and the advancements that we're seeing in the simplicity of using the KBMO profile is it allows for us to also look for foods that induce inflammation. And quite frankly, that's what I'm looking for most of the time with my diet transitions with my patients. And so going into the gut, you know, as a practitioner, we certainly see that food can be a primary trigger for so many of our patients on a day-to-day basis. And this evolution of this new version of the KBMO 176 fit test with the included gut barrier panel, what's so nice about this new profile is we are now screening for food sensitivities, we're identifying those sources of inflammation, and the new expanded profiles within the last 2 years give us the gut barrier profile, along with looking at some of the important insights to dysregulation and challenges that we're going to face inside of the microbiome. So what are the types of patients that are coming in the door where I'm thinking food first? All right, where I'm leaning food first. And so it's your classic list. I'm sure many of you are dealing with the same issues in your own office. So mood challenges, mood instability, fatigue, exhaustion. Some of the classic symptoms in which we're going to see gut dysregulation and gut challenges quite obvious, but extending this over into headaches, chronic pain syndromes, and quite frankly, I have had I guess I would call it a boom or a substantial swell in my practice this year in seeing patients who are presenting with long-haul COVID. And so this is an absolute imperative step in the management of the patients we're working with. I myself ended up developing long-haul syndrome, quite surprisingly. I was the healthiest I have ever been last year at the age of 50, right at my 50th birthday. I got my third and my worst case of an acute COVID infection, and it knocked me out for about 6 weeks. I was at my peak health, I was at my peak working and my strength, my capacity. Really, honestly, I never felt better. And I got sick on my 50th birthday, which was like such a drag. You know, I was looking forward to that birthday for so long. And it took me quite some time to recover. I was kind of set back and kind of surprised, considering I've been eating good and moving great and taking all my preventive supplements and nutrients. And interestingly, almost to the day, 6 months after I had that last acute bout of COVID, all of a sudden the inflammation turned up. And without me recognizing in the moment what was happening, I moved very quickly within a few weeks into a severe and challenging and debilitating state of long haul. And so last year at Christmas time, I was redoing my will. It actually makes me a little bit emotional. I haven't really told very many people my story. And I was writing letters to my kids. I was writing goodbye letters. I was packing boxes of my favorite things from all my travels and leaving notes for my kids. I was so sick. Came on quick, fast, like so fast. It took me bringing in like 4 or 5 of my peers who teach in this world to help me look at my data and crank through my timeline to figure out that what was going on was long haul. And so since then, I have worked through the Ovation Lab programs for post-viral recovery. I can say it absolutely gave me my life back, it gave me my brain back, it gave me my family back, and I have taken actually back teaching, which I really was pulling back from for quite some months because of the challenges that my neurologic system was experiencing. And so now to date, I can say I've run about 180 patients through long-haul protocols in our office. I'm getting substantial results, and this is the wave of our future, right? We are going to be seeing this in neurology, we are going to be seeing this in general practice, and in my current experience, practitioners do not know what they're looking for. When we look at the data right now here in the United States, it's absolutely stunning. It's shocking to see the prevalence that's starting to emerge with long haulers right now. So I'll tether back. You know, KBMO for me is all about the gut, but I just need you to know my big gain, my big extension and application of KBMO within this last year is with my long haulers. And so I'm running groups with my long haulers, and I work hand in hand with a clinic outside of the Minneapolis area, the Functional Neurology Center there. I do all of their functional medicine work, so they take all my neurology cases and I take all the functional medicine, and so we work in tandem. And I can say I've been seeing through those neurology referrals some of the sickest patients that I have ever met to date, and quite interestingly, many of them who are presenting with the long haul cascades also have these interesting histories of antecedents that include Epstein-Barr syndrome, right? We are seeing Epstein-Barr is a very important antecedent to be looking for in our long haul cases. And you know what? I hadn't thought about that I had Epstein-Barr when I was in 7th grade for honestly like 40 years. You know, it's been like 30, 35 years since I even thought about any of the patterns I had from having mono back in junior high, right? And so a very interesting opportunity to really expand the application of our KBMO testing, and this population for us has been very successful in being able to tailor their diets and to be able to get some of the inflammation, endogenous inflammation, under better control. So as we all know, we start in the gut, and the key things that we are often looking for when we're concerned about those challenges with toxemia, endotoxemia, various different levels of inflammation that may be crossing over that blood-brain barrier, we want to go to the gut, and we want to be clear about what is the integrity and the quality of this gut barrier. And of course, we want to dig deep into that microbiome and get a good sense of, are there challenges, are there complications in those gut bugs that we want to modulate, knowing that we are careful about looking at those lipopolysaccharides or those various endotoxins that can be impacting neurology. So downstream effects, we're obviously looking for the related GI complications. And as I would assume all of you have been trained on, understanding the important role, the power of knowing where and when that leaky gut is present, we need to go to the gut to do root cause care. And for many of our patients, just managing the symptoms doesn't go deep enough. And so therefore, when we look into the gut, the new advantages of being able to capture this data off of a point of contact finger prick, either in the office or to have a patient do this testing at home and submit to the lab, is really a breakthrough. You know, the pandemic delivered for many of us some advancements in technology and certainly some eases in the way that we are able to meet and greet our patients. But now through telemedicine and through Zoom, we've got the ability to send a kit to the patient's house. So if they're not in the office with you that day, you also have the ease and the ability to submit the test, send it to their home, have the patient collect the sample, submit it back to the lab, and then to be able to move forward and support their healing process. So we all clearly know the common triggers that lead to the breakdown of the gut and the gut scenario. What is so unique and why this test stands out, and I can say ever since I started running this lab in my office 5 years ago, I really haven't gone back. I haven't gone back to using any of the other previous labs because my clinical results are better. I'm getting more data more quickly. I'm finding my patients are having response patterns that I hadn't seen in the previous 20 years of clinical practice. So this, as the sky and the heavens agree. Exactly, a boom that comes through. So what makes this test so unique? One of the things that's so remarkable about this test is not only are we looking at and using these technologies to identify advanced sensitivity determinations, but we also have the ability to look at the way in which complement downstream is going to be connected to triggering inflammation. So quite frankly, in most of my patients walking in the door, whether they're coming in for gut, brain focus, brain fog issues, headaches, migraines, underlying most of the conditions that walk in my door is inflammation. And so it means that diet and lifestyle is where I'm always going to start. I'm going to always start in a food-forward manner and food first. I want to clean up the diet, and I want to be very clear and focused with my patients on what they are eating and what they're not eating. And this tool provides that for us. And so I just wanted to pop up, this is a recent publication having come out looking at long haul. And I just wanted to show you one of the interesting things about looking at the cascades or the trajectory of dealing with the long hauling patterns that we're seeing is what we're finding is it is somewhere around the 6 to the 12 month mark that most of the long haul symptoms are starting to present themselves, right? So we've got these different stages of care. We've got acute COVID management, and then we have that post-acute sequelae of COVID, which can last and linger up to 3 months. And then keep in mind that the data right now is showing 1 month post-infection, we've got about 30% of the population that currently right now is still experiencing symptoms of the original infection. You go up 3 months post-acute infection, now those statistics are showing that this is dropping into the 6 to 10%. And when you go up 1 year from that original infection, we are still seeing 1 to 2% are dealing with severe complications centered around inflammation and tissue damage. And you know perfectly well the neurology is one of the areas that is hit, that is highly susceptible, as well as the endothelial tissue related back to our ACE2 receptor site sensitivity. So there's a brilliant publication that was just submitted. I will try to, what's the best place to get data? James, do you have access to that article I sent you this morning? Is that something that we can pin to your website and make available? So there's now what has been identified as 5 drivers underlying COVID and underlying the development of long haul syndrome. And what I wanted to shine the light on and point out is we are seeing the inflammatory correlations and the inflammatory connection as a central driving force in managing and working our patients through this process. We are all familiar with the impact to the gut. We are absolutely learning so much about the gut microbiome as it comes back to relating to COVID. Some of the interesting susceptibilities are now starting to emerge that microbiome patterns have set individuals up to become long haulers. And then once you become a long hauler, your microbiome is altered from then on. So the gut relationship and the gut role is a very imperative part of supporting the cascades of inflammation, endothelial damage, and some of the challenges that we see with the autoimmune behaviors that are upregulated and triggered. So there are now what is called 5 driving factors of the underlying components that lead to the long haul syndromes. Why am I including this in our discussion about the gut? Well, when we dive into and we look at those ACE2 receptor site locations, right, and we have that level of familiarity, many of our patients either when they experienced COVID or maybe didn't even know that they were exposed, many present with GI-related distress and GI-related challenges. Right, and as we watch those progressions move on, we've got those ACE2 receptor sites present in the gut. Many of our patients will come through various different infection states and end up with that soft stool, a diarrheal pattern, challenges impacting digestibility. We're all quite familiar with the impacts in other tissues around the body where those ACE2 receptors are. High damage we're seeing reported in the endothelial tissue and challenges that we're seeing impacting neurology and brain fog. So I was happy to be walking down the hall out here and saw Calroy down the hall. Calroy is the company that makes our Tirasil. I'm not sure if you had a chance to see them. That's one of the formulas, honestly, that I feel like put me back on track again. That our Tirasil formula works with healing the glycocalyx inside of the vasculature, right? And so we get vascular recovery and improvements to the trauma and the damage that's happening in those highly susceptible tissues. Right? Because so much of the brain fog challenges that these patients are experiencing is because of the inflammation and the damage that's happening within the vasculature, within the brain, the neurologic system, within the lungs, within the liver, etc. So especially those patients who came in and said, yeah, I have blue toes, I have blue fingertips, I have blue lips, right? If you are like seeing that level of hypoxia and that level of vascular damage to the tissue, you want to be thinking root cause. And healing and supporting that endovascular tissue is really at the top of your list. This study also, coming out a couple years ago, highlights that the 2 main areas, if you want to bring it down to the common denominators, what are the common denominators of the long haul syndrome that we're seeing today? The 2 huge common denominators are tissue damage and inflammation. That's it. And every complication that we're looking at right now that long haulers are experiencing, the brain fog, the fatigue, the exhaustion, the exercise exhaustion. I have to say, my husband and I own a gym. My husband's a retired Muay Thai kickboxer. So we run classes all day long. We got little ninjas in there. We've got patients with Parkinson's who come in for balance here. Like, I was at my peak performance before I had that last round of COVID. And what shocked me was my inability to exercise and how quickly that came on. right? So if you have healthy individuals, people who are eating good, exercising, people who really know how to live a healthy lifestyle, and they're telling you they can't exercise without exhaustion and fatigue, they're not able to perform at the level that they were before, please step back and do that advanced timeline, go into that history and look to see if there could be a potential exposure, right? Because the data that is coming out now is showing it doesn't matter how sick you got when you had an acute infection to determine whether or not you're going to be long hauling. And that's a huge breakthrough. That is a huge breakthrough in our understanding of what is going on. Inflammation drives this process under the surface. Little did I know what was my big antecedent that made me so susceptible. Challenges in my genetics. I'm inadequate at producing glutathione levels. I have upregulation of producing inflammatory cytokines. I have a host of diabetes genes and metabolic complications in my family history. And so those factors were present, and then, boom, my Epstein-Barr reactivated. So the data is coming out right now showing that those who are the most susceptible to this chronic inflammation and this severe chronic immune response syndrome that most of these patients are experiencing, you want to look back at infection, dormant stealth infections like Lyme, like herpes, right? Look at some of these important underlying factors because the literature is really starting to shine the light on this is the patterning, and we're starting to be able to see proteome expressions that can predict who's going to become long haulers, right? And they're going to end up with pain, fatigue, exhaustion, and brain fog, right? And we're seeing them every day. And the statistics right now show in the United States, there were 2 million individuals who were identified as having had COVID, and they are now seeing that we are 1 to 2%, depending on the population assessment you're looking at, who have developed long haul. That is 2 million to 4 million Americans right now through their complications, their neurologic challenges, their gut challenges, their exhaustion, their insomnia, their headaches, is coming back to the fact that the spike protein fragments are attached to those ACE2 receptor cells and causing chronic inflammatory tissue damage. So you've got to heal the endocalyx, you've got to heal the inside of the vasculature, you've got to take these steps to be able to turn down the autoimmune, and KBMO is where I start with these patients. I start there. We start with a good, solid, healthy food base. If that's something you want to learn a little bit more about, please feel free to reach out to me if you want. I've got Facebook groups that I run, and I work with a lot of healthcare providers and nutrition professionals around the world. If you want to jump into my free group, you can. I post articles and studies in here all the time. And every Monday morning, I meet with a mentorship group, and we spend our mornings on Mondays going over cases, protocols, and how they're going to use functional medicine to be able to reach their patients. So I'm absolutely accessible in that realm. So let's dive into the test. And so why am I choosing this test over and over again? And not only this new population of patients that's surging, but the standard things that walk in my door, right? And so we're using this tool and this testing capability because food moving through the tube is one of the most variable things that's happening every day. And quite frankly, I am shocked at how often patients are eating the foods that are provoking the highest level of inflammation and complications. And so there's a coaching strategy often that you're going to have to implement when you change the diet, right? Changing somebody's diet is not easy, right? But this tool makes it a lot easier. This tool allows for us in our own clinical practices and with our patients to really hone in on and say, well, which foods do we need to cut out? Which foods do we need to mitigate or minimize in the food program? So the report comes out beautifully, and I have to say, if you're using any nutraceuticals in your practice, that's one of the reasons I love this test, because it helps me pull out a host of ingredients that my patients may have an inflammatory or complicated picture triggered by. So my patients have been taking fish oil for years, and their reports come back and they're sensitive to squid, they're reacting to the calamari in their fish oil or the salmon in their fish oil, and my least favorite results, I can't believe how often turmeric comes back positive. I have to tell you, like, it just makes me mad when I see turmeric coming back in these patients, because now we've got to find another way, right? We've got to find another way to get underneath that inflammation. And so often my patients come in, bags of supplements, like bags of supplements, and they spread them out on my desk, and they say, do I have to take all this? No, you absolutely don't need to be taking all of that. And this test helps me figure out if any of those supplements are provoking or could be a part of an inflammatory response. So I use this as a starting point for the diet, and I use it as a substantial guide in helping me know which tools in my toolbox I don't want to use with that particular and specific patient. So when the food reports come back, beautifully and easily the patients can view them and see light green, yellow, orange, red reactions. And then we can start down this process of figuring out, well, how are they going to eat to meet the best needs that their system is asking for? So ideally, I like to see them pull off all of the food triggers, even the light greens. I'm a little bit strict that way. I pull them off all the food triggers for the first month. I'm like begging and negotiating for 21 to 28 days with them, because I want to see how much changes with diet alone. I want to know when we pull all those foods back, what kind of symptom improvement is happening. And then we're going to move on, and we're going to keep moving forward. So overall, you'll see these high reds and oranges. I tend to keep my patients off of those for that 3 to 6 month window. But as they're feeling better, we're going to slowly start to dabble with those light greens and slowly start to dabble with those yellows again and bring them back into the diet. But one of the most imperative things that we know about these patients is whether or not they have a permeability problem in the gut. If they've got an intestinal permeability problem, that's where we need to start. And what I love about KBMO's report is I don't have to go out and start running stool cultures right out of the gate. I used to do a lot of stool testing in my practice. For years, I've been doing stool testing. Now I start here with this test. I start with KBMO. I look at the gut barrier results. I look at the zonulin. I look at the occludin levels. I want to know if there's a candida problem for this patient, which also may be prompting and telling me, we better dig a little bit deeper into a mold background or a potential mycotoxin history. And I want to know if there's lipopolysaccharides there, which will tell me we've got a disrupted gut. We can get that off of one test, off of one finger prick. We didn't have that for years in clinical practice. So one test now can open up that portfolio of knowing, well, where are we going to go first with our patient, and how are we going to move the needle very quickly for them. So as you know, the progression and the understanding of how and why intestinal permeability is leading to inflammation is becoming more well substantiated. If you sort of look at the natural medicine world, or you look at the functional medicine world, I've been talking about leaky gut and the impact it has systemically for over 20 years. And the literature beautifully is catching up with that discussion and helping us understand downstream how we have that inflammatory cascade taking place. So treatment-wise, we want to step back and be mindful of not only the food triggers, but we also want to be mindful of looking carefully at the structure of that gut, getting a good sense of whether or not we have seen that breakdown and that release of those key and core proteins that are stabilizing the GI tract. So the gut barrier panel has continued to grow, and as of last year, we had the expansion of our KBMO food panels to include the capability of screening for zonulin and occludin. And both of those are going to be your gauge or your indicator to know you've got a leaky gut. And why I want to know that is that helps me know whether or not the food triggers showing up on my patient's profile are going to be foods that we have to stay away from for the rest of their life. Or are we going to be able to treat that gut? Are we going to be able to heal the permeability? Are we going to make improvements in the gut which would allow for them to sort of grow out of or heal through some of the sensitivities that they're dealing with? Right? When patients come back and their zonulin and occludin levels are negative and not problematic, I'm much stricter with my KBMO food report. Because I know those are foods provoking inflammation and not because they have a permeability problem. Those are foods that provoke inflammation in their system. So I'm going to be a lot stricter with those patients, and I'm not going to take the methodology that's going to say, well, in a couple months or in 6 months, we're going to try to put these foods back in. Because treating the gut in those patients is not the method that is going to help us reduce or mitigate some of the severity of those symptoms. When we do have positives coming through here, and I know we've got a confirmed leaky gut pattern, I absolutely am going to encourage the patient, do the best you can with your diet for a few months. For now, we are going to manage the gut. We're going to dig a little bit deeper into your microbiome and see what we can determine and figure out to heal and make those improvements. And now what is so wonderful about having the single page gut barrier panel is now you can just go back 6 months later, 12 months later. You don't have to run the whole test. You can just repeat the gut barrier panel and get a sense, an immediate check and balance. Is my leaky gut program working for this patient? Right? Is it working? Are we getting the clinical results that we are expecting? Now they added to the gut barrier panel also candida indications. As I mentioned, when I'm seeing candida showing up, whether it is systemically, a systemic inflammation response to candida, or more of a secretory IgA or gut-derived level, helps me get a better sense. Is this a systemic problem, or is it more isolated to the GI tract? And then also, when I see those progressive levels of candida, as I mentioned, I'm going to go in and I'm going to often take a mold history. I'm just going to ask a lot of questions about where do they live. Have they been exposed to water damaged locations or places? Oh my gosh, I had one of the worst test results. I have hired a medical doctor, an MD works in my office, and she's a mold expert. She's a Lyme and a mold expert. And got some of the most severe test results back that I had ever seen. And I said, I'm gonna send you to the mold doc, we're gonna work with her together. And interestingly, I said, did you ever have any mold experience that you can think about? He grew up in Germany and he had like lab levels that she had never seen before. He said, yeah, I remember when I was 5 years old, my mom threw all this moldy bread into the garbage, and I didn't know why she threw the bread away, and I thought it was so cool that it was green and foamy. He like dug the bread out of the garbage can and like ate this bread completely covered in green foam. So it's like, what triggered my thought? The candida and the disruption in his gut microbiome, and looking at his clinical symptom picture and thinking, okay, diet alone wasn't good enough. Starting to work with some of the simple aspects of managing the candida wasn't good enough. Ask more questions. Keep digging deeper and ask more questions. So we know zonulin is a wonderful indicator. It's going to give us the insight in our patients with autoimmune challenges, in which we will commonly see those patients with joint pain, skin problems, gut issues. We'll be presenting and we're going to look back and see, yeah, there was an intestinal permeability challenge here. So we know zonulin is such an important protein. It helps hold those tight junctions together between the cells, and when zonulin breaks down and we get these cross reactions now showing up in the blood, we have a great understanding of some of the challenges that GI tract is encompassed with. So we do know now, and I will defer to James if you want to talk a little bit more with the team at the booth. They'll talk with you a little bit more around Fasano's work, but his work is on blood testing, not stool testing. And so the data and the accuracy is there when we're looking at the levels of the reporting data that is coming back for us and understanding the markers of both zonulin and occludin. So occludin is interesting because it too plays a role in intestinal permeability, but it's a much smaller fractionated protein. And so therefore, when we see the progressions of a leaky gut, we're getting elevations of zonulin and we're getting elevations of occludin. So we want to take that opportunity to be able to screen for both. So the reports come back, and I start on the back page. I actually start interpreting them with the patient by looking at the last page of the gut barrier, because that's going to put it into context for me. It's going to let me know how serious is the diet, do we have to be really picky, can we live an 80-20 lifestyle, or how are we going to move forward, and is the gut the source of where the food triggers have come from? And then now, as of June of this year, just recently, there's been the inclusion and expansion of this profile to bring in lipopolysaccharide assessment. Right, so we know with lipopolysaccharides, now here we are looking at the production of endotoxins coming through the gut. So to know that is so beneficial because those lipopolysaccharides have such an impact on neurology, pain, and fatigue. So I certainly appreciate the expansion, especially when I'm looking at patients who are coming in with cognitive challenges, pain, and fatigue syndromes. So LPS, and now I know if I see Candida and LPS coming back positive on this report, I might go on and order stool culture. I might go on and actually culture the stool out because I now want to know a little bit more about what else could be growing inside of that microbiome. So systemic lipopolysaccharides are linked to many challenging complications, including brain performance and neurologic considerations. So those lipopolysaccharides, right? You got a leaky gut, you've got a permeability problem, and the presence of lipopolysaccharides, you can be thinking about leaky gut, leaky brain, and you can be thinking about those complications that could be happening downstream for those patients. So we know lipopolysaccharides lead to even more elevated levels of endotoxemia and even a higher driver of those inflammatory cascades. So a quick case study and then I'll wrap. So this is a patient, Donna. Donna came in with a chronic cough and exhausted fatigue and brain fog. When she came in, she had been circling the drain from specialist after specialist after specialist. Her test report came back and we thought, wow, look at the disruption going on in her gut and how interesting that she wasn't expressing any of the challenges related to a permeability problem. We went on and moved her through a COVID long haul program. She responded beautifully, had about a 70% improvement overall in her symptom patterns. We got her off of all of the primary foods that were a challenge for her in her diet and went on to detect and pick up for her a severe mycotoxin picture. And so she is now, as of yesterday, she was in the office, as of yesterday, this chronic cough that she has not been able to resolve since that exposure to her COVID infection. She cleared, like I said, 60 to 70% of that cough with her work with post-viral recovery. But in the last 4 weeks, with treating her with a cholestyramine and utilizing a biofilm buster and an antimicrobial up in the sinuses as a nasal spray, her cough as of yesterday was about 95 to 98% better. Huge breakthrough. So my comment to my clinical pearl is, wow, I am impressed with how often that candida picture and the lipopolysaccharide picture points me in the direction of thinking about environmental toxins and other impacts that could be affecting the nervous system, especially patients with headaches and chronic coughs. So this is another case. Oh, he was so severe when I met Paul. Paul came in, he had his ileostomy. He had been dealing with severe colitis for the previous couple years, triggered by a C. diff infection. And so he had already been through 3 functional medicine doctors before he came into my office. And so he surprised me with his first test result here, because the docs he had been working with were working on his intestinal permeability. So it was just a wonderful check and balance to look at old data, run this new test, and kind of hit the ground running with him to say, hey, the great news is you're not dealing with a small intestine challenge right now. But he did have complications and challenges with candida, and his biggest problem was his reactions to wheat, gluten, dairy, and eggs. And so with all the work that he had done, he had not been able to hone in on the right food plan that would transform and change his gut. He's managed at the Mayo Clinic. He is now 100% been pulled off of his Stelara. He no longer has his bag anymore, and he is moving healthy, remarkable bowel movements on an ongoing basis and continuing his follow-up at the Mayo Clinic. So that is Paul. So where do I start? Well, I have taught for both KBMO, and I have also pulled together protocols and training programs to teach practitioners how to use nutrition and nutraceuticals. And so if you would like to have access to how do I manage permeability problems and deal with these infections, James and the KBMO team had me teach a webinar series this summer. And so if you go to KBMO's website, you will see in their education section, there's a 4-part mini-series. And in that series, I've got all the details about which formulas, which protocols do we use. I always start with pre and probiotics and phytonutrients as the base of all of my patient care. I build upon that quality essential fatty acids that are right and ideal for that patient's needs to mitigate the inflammatory concerns. Then I will go on and use a functional food or a medical food if necessary to provide them with anti-inflammatory protein combinations. And then we'll go on and we'll target specifically any particular therapeutics that are required. So I'm more than happy to share that information with you. I haven't talked this fast in a long time, James. My dinger dinged, I'm 3 minutes over schedule, so I want to thank all of you for letting me be here, share with you. KBMO has not only been a game changer in my practice, it has absolutely changed the way I parent everybody's reports hang on the refrigerator. I'm not even kidding you. My one kid, we found out, my one kid who has oppositional defiant disorder and ADD, ADHD, my one kiddo who is my hardest kid. Now he's my ApoE 3-4 kid, who is a skateboarder, who has had about 14 concussions, so start like adding up the math here. So it's my tough kid, he's like, just turned 15 right now. Allergic to gluten, gliadin, right? Gluten, gliadin, wheat, corn, rice, potatoes. We got this kid's report back, and his siblings were like memorizing their brother's sheet, right? And they will literally call him out on his French fries, or if he eats something, they're gonna be like, Ori, don't eat those, because you know you're gonna get crabby later today. All right, so my whole family, I got 4 kids, their KBMOs hang on the fridge. And so when we cook, we're mindful of each other's sensitivities. And so this test has changed my home, changed my practice, and for me personally, has been a game changer in helping me eat the right way. So faster, more efficient, incredibly innovative, and has been able to shorten the length of time it takes me to figure out where to start with my patients to be able to get that first round of positive response. So thank you all. I appreciate you.